Cancer Awareness Month, observed every October, shines a critical spotlight on the growing impact of cancer worldwide. In Nigeria, cancer awareness has seen gradual improvement, but significant challenges remain in early detection, treatment access, and public education. Cancer remains a significant public health challenge in Nigeria with rising cases of limited awareness. Many Nigerians overlook early signs either due to a lack of awareness or the stigma attached to the disease. Addressing these issues can lead to earlier diagnosis and better survival rates, especially as most cancers detected early can be managed or even cured. I am Aisha Salihu, and this is Healthy Living on Trust TV. Today's episode of the program is a sequel to our last week's episode. Still in the spirit of the World Cancer Awareness Month, we would be having an oncologist who would be joining us virtually to draw lessons from our survivors' experience. We have Dr. Mohammed Jamilu, who is the Assistant Director, Medical Services, Kebbi State Ministry of Health, and also Kebbi State Cancer Control Coordinator. Thank you so much for joining us on the program, Dr. Mohammed Jamilu.
Thank you very much, Aisha.
Now, before I come to you, as a reminder, let us take a quick look at our cancer survivor, Gloria Oku, who was diagnosed with breast cancer as at the age of 32 in 2017. Without a prior knowledge of a pre-existing family history, a discovery that changed the course of her life. Like most people, she was faced with the reality of accessing treatment options. Even with surgery, she had her fears regarding chemotherapy and radiotherapy. This pushed her to seek herbal remedies until her chest walls started growing lumps, leaving her with no option but chemotherapy and radiotherapy. Although she is now dealing with the resurgence of the cancer in her bones, her liver, and lungs. Let us take a look at a snippet of our conversation with Gloria from last week.
I was diagnosed in March 2017. But before then, I noticed a lump in my left breast one fateful evening in August 2016. Before that, I never checked my breasts. I didn't know much about cancer, so I never checked, basically. But that evening, I don't know what happened, and I just felt my breast, and something was hard on the side. And I got a bit concerned, so I went to a hospital, a private facility, and they said it's benign. But they advised I should still do further tests. And so that was how the journey started. For the next 7 months, I was shuttle between hospitals, doing scan, mammogram, and finally a true cord biopsy. And in March, they told me the lump was malignant. And that was how the journey started. It has not been an easy journey for me, because merely I was told, like, I had this diagnosis just 1 month after convocation from school. So, you know, the euphoria of graduating from university after so many JAMB attempts, I was just looking forward to starting my life, and then this happened. So as doctor told me that day, "Oh, madam, this looks like cancer, and if it's cancer, we will chop off your breast." Those were his exact words. When he said that, the whole world stopped for me. All I was thinking about was dying and leaving behind my 3 young children, and leaving behind the certificate I worked so hard for, you know. So the next stage for me, after the shock, was acceptance. And so I asked, what next? And I was told I had to remove the lump. I had 2 options. Either I remove the lump and do radiotherapy on the affected breast, or I would remove the entire breast. Meanwhile, the stage was stage 2, so which is considered early. So I removed the breasts as advised the same month, and after that, I was referred for chemotherapy, radiotherapy. But I didn't go. I didn't continue with my tests. I didn't with my treatments, because I was told that chemo would kill me, especially hearing it from A health personnel I respect so much made me not to want to do it. Like chemo kills, and also the costs. Like I said, I was just out of school. I have 3 kids to manage, so I couldn't even afford my surgery, let alone a chemotherapy. So I made up my mind I wasn't going to do it, especially after I was told there was no spread to anyone. So I felt I've removed the affected organ.
That was Gloria Oku telling us about her experience with breast cancer. Dr. Mohammed Jamilu, if you can hear me, you have just seen the story
Yes,
of
I can.
Gloria Oku, but then let us begin with, I'd like to hear from you. What specific signs and symptoms should Nigerians pay most attention to? I mean, given our unique cultural and environmental factors.
Yes, thank you very much. And I've heard what Gloria has said. And actually, October is celebrated as the October, the month of Breast Cancer Awareness Month. So the signs and symptoms of breast, not breast cancer as such, but any suspicious lump in the breast. One is abnormal lump in any of the breast. Then there's redness around that lump. Then there is something we call beauty orange, which means that you see the skin of the breast looks like that of an orange. And then sometimes if care is not taken, then the breast also becomes it forms an abscess on top of that lump. Abscess means a collection of pus in that breast. So basically, these are the signs and symptoms that any suspicious lump will present with in a patient.
Okay, thank you so
And
much for putting
it's
that
only,
out
it's not
there.
only in the females. We also see breast lumps in males because they also have breast cancer.
Of course. Now, Gloria said has presented with a lump in her breast, but now this now brings me to the next line of question. I'd like to hear from you. How can regular cancer screenings be made more accessible across Nigeria, especially in rural areas?
Yes, actually, that's the main challenge we are facing because of the accessibility to screening in our various facilities. But breast cancer screening per se, it's not expensive because it has to be a clinical examination from the physician's point of view. The only challenge comes when a patient has to go for biopsy, which means he has to spend a lot of money to take that excised lump to the hospital for the histopathologist to run the test and see to confirm whether it is cancerous or not. So screening actually shouldn't be a problem if women can go to the hospital and they can also do it themselves. There's something we call self-breast examination. We usually advise women to check their breast usually at the end of every menstrual cycle, especially if they are above ages of 35 and above, to see the breast at the end of the menstrual cycle, maybe to see if there's any abnormal lump, if they can palpate.
Okay, doctor. Now, according to statistics by the World Health Organization's Cancer Agency, the International Agency for Research on Cancer states that as of 2023, Nigeria has approximately 233,911 cancer cases, with 124,815 new cases and 78,899 cancer deaths annually. Now, what would you say are the primary lifestyle factors that could contribute to the high cancer rates in Nigeria, and how can they be managed?
Yes, actually, the lifestyle factors that are responsible for cancer, we have to know, first of all, sometimes the cancer is inherited from parents. That's a gene is inherited from parents. Then secondly, there is use of contraception, the what we usually call the family planning pills. Then thirdly, there's a lack of breastfeeding in women that don't breastfeed their babies adequately. I think these three things are the major causes of breast cancer. And then, of course, there is a neglected breast lumps. These are the most important things that cause breast cancer in males and females.
But then I'd like to hear from you. What would you say are the primary lifestyle factors I mean, how people live their lives that could, protect, that could bring about cancer, especially breast cancer?
Yes, if we're talking about breast cancer, actually, basically, these are the things I've mentioned. And those things are, there's one you cannot actually prevent, that is the hereditary part, which is the most important factor. It is the most, the factor that causes the breast cancer, apart from the maybe obesity, then what you contraception, that's family planning, and then breastfeeding, inadequate breastfeeding in females. Those are the only things that will cause breast cancer.
Okay, now let us look at diet. How can you elaborate on how diet and environmental factors play a role in cancer prevention?
Yes, it's not just breast cancer. There are other things that cause cancer, like smoking, like sedentary lifestyles, but those are not limited to breast cancer per se. They are associated with other cancers like the bladder cancer for smokers, then like lung cancer for smokers also. Then there is maybe a lifestyle in fishermen whose work is to stay by the waterside, which brings about schistosomiasis, which brings about bladder cancer. So depending on the cancer, there are other lifestyle factors that are responsible for cancer. But for breast cancer, it is that use of contraception, then obesity, and maybe smoking.
Okay, now I'd like for us to explore diet. I just want to know how diet can, play a role in cancer prevention.
Generally, dietary intake, it means you have to take lots of fruits and vegetables and things like we call antioxidants, which bring about boost in the immunity. But like I said earlier, it's not that the most important factor which you cannot prevent by diet or anything is the hereditary part. So the only thing diet can do is to boost the immunity and also, but it does not per se prevent you from getting cancer.
Okay, now I understand that family history is also very important in cancer, the case of cancer
Yes.
coming up, because just like Gloria stated, she didn't even know that she had the family history. Her aunt died of the same disease, her father, and also other members
Yes.
of her family, which she later found out that she's also carrying the same thing has been transferred to her. But then I'd like to hear from you. What would you say are the most common challenges Nigerians face when seeking cancer treatment, and how can these be addressed? Bearing in mind that from Gloria's story, she did say that when she was eventually diagnosed in 2017, she realized that, it was cost intensive. She couldn't access the treatment according to the options that was available to her at the time. But she had to just go straight to, take out the breast. And then she had her fears regarding chemotherapy and radiotherapy, which we would later go back to in the course of the program. But I just like to hear from you. What are the most common challenges Nigerians face when treating cancer?
Yes, thank you. The most common challenges Nigerians face first is indecision, actually, especially in this part of the country, because the women mostly don't decide here. They should have to hear from the husband and the family members. So for any patient to come with a breast cancer and she gets the word from the doctor that breast has to go, is a major decision. And by the time they decide on what to do with that breast, is already presenting at the late stage. Then if they do decide to take off the breast, then the issue of finances come in, because chemotherapy is very expensive. Each course minimum will cost around 50 to 70,000 per cycle, and that she'll have to go for at least 6 cycles to complete the chemotherapy. Then there is funds for surgery. Then when she's done, also there's radiotherapy to top of the medication. And radiotherapy is not readily available in Nigeria. You'll have to go to Abuja, Maiduguri, or Ibadan. So that also is very expensive, costing in millions of naira. But the issue is financing. The cancer treatment is really, really expensive. And that is what actually is killing most of the patients. Because you see patients doing very well during the surgical part and the chemotherapy part. When it comes to radiotherapy, they will not have enough funds, or they might not have funds at all to go for radiotherapy, especially if they have to travel outside the state to go to Abuja or Ibadan, a place where they're not even familiar with. So most of them end up just finishing the rounds of chemo and then stop. And at the end of the day, cancer comes back because the treatment has not been completed.
Now, I'd like to hear from you. How then can we address this challenge, just so we don't have a repetition of this cycle?
Yes, the way we can achieve this and address this challenge is like what we did in Kebbi State. The government and opened an indigent cancer fund where well-to-do individuals from Kebbi as well as the government donate into that account so that anybody that is diagnosed with a cancer access those funds from that account. Then also we have established a chemotherapy center where we have trained oncologists and oncology nurses where patients can go and receive treatment free or almost free, because it's not just breast cancer, it's for most for most cancers. Then also, if the government can at least establish radiotherapy centers in the six geopolitical zones where patients will have access to, like what the NHIS is doing now. There is a cancer fund, National Cancer Fund, I think, which patients can access for them to have their cancer treatment at a discounted rate or at the discounted price. I think then another issue we can do is to offer maybe the histopathology screening or histopatological slides free, like we do in Kebbi. If we take a slide, we collaborated with the Federal Teaching Hospital, where they give a discount on the slides that we send to them. I think that will go a long way in reducing the cost of cancer treatment for patients. And by and large, in Kebbi State, we are having more patients turning up to check their breast and cervical cancers if they are is all active.
Now, we have looked at treatment options and what can be done regarding the challenges in these treatment options. Now, this now brings me to this question where I'd like to hear from you. How do treatment options in Nigeria compare with international standards, and what advancements are needed to improve local treatment outcomes?
Actually, we are doing well because recently there are more centers coming up, private facilities that are doing brachytherapy and other forms of treatment for cancer patients. So mostly cancer treatment is surgical. We are doing well in that regard. Then chemotherapy also, we have good quality drugs that have been that are available in Nigeria. We also collaborate with companies like Roche and Johnson and Johnson, which are into breast and prostate cancer respectively. So those drugs that we are using and the surgical part, we are doing well. The only problem we are having is when it comes to radiological part of cancer treatment, which I mentioned is because we don't have much centers around the patients can go and access care. But in terms of surgery and the chemotherapy, I think we are doing well.
Okay, doctor, I know we have earlier established the role of genetics and also, family history. But now I'd still like to ask,
Yes.
what role does family history play in an individual's cancer risk? And should Nigerians consider genetic testing?
Well, that is a very good way to go, but as now it's not actually an option that is available. But I'll give you an instance. There is this well-known actress, Angelina Jolie. Because there is a family history in breast cancer, she got both her breasts removed. That is prophylaxis, so that she will not get the breast cancer. But I think what we should emphasize now on is the screening, actually, so that we know, because sometimes you might not even know there is a family member that has had breast cancer in your lineage. So that is something I think that will be in the futuristic thoughts.
Okay, now still in line with genetic factors and also family history, can you clarify if certain cancers are more prevalent in Nigeria due to hereditary factors?
Yes, actually, the ones we have seen in the who presented in the hospitals, majority of them are having a family history of breast cancer. Actually, almost 80 to 90% of those that presented with breast cancer have family history of breast cancer.
Okay. Now let us now come to the point where we debunk certain myths and misconceptions. What would you say are some of the most prevalent myths about cancer in Nigeria, and how can healthcare providers help dispel these misconceptions?
Yes, actually, those myths that we've been hearing about breast cancer, for instance, some of them actually are to like issue of breastfeeding. They say they may be suckling the breast to reduce the incidence of breast cancer. Then the use of maybe cosmetics like some creams or anything would cause breast cancer. Those things, they usually contribute, but not as much as we actually portray. Just like I've mentioned earlier, like contraception. It's not that contraception you're going to have breast cancer. It is consistent use, and it's almost in some cases, not in all cases, that have breast cancer. But these few that I know of the misconceptions, these are the only ones actually we hear about.
Okay, now let us talk about Gloria now as a case study. We had earlier when she stated that why she didn't consider chemotherapy and radiotherapy shortly after her surgery was because she was told it could kill her. I'd like for you to clarify that for us. How safe is chemotherapy and radiotherapy?
Yes, actually, the standard is that no drug is safe, but we all know those chemotherapy agents, they're actually toxic drugs. But the issue is that they do the work that we want them to do. And like I told you, it actually eats the patient, but if it is properly done, the patient gets cured. But for the part that kills, it's not actually true that the drugs kill. It's just that the drugs will take most of your energy. Most of the times you'll have to go for blood transfusion before each cycle. So those are the things that I think patients feel that maybe the drugs, because some actually drop out of the chemotherapy once they start, because you have your hair falling off, your skin becomes darker, you are always weak due to the effects of the drugs, because they only not attack the cancer cells, but sometimes also the normal cells.
Okay, now I'd like to hear from you. How can we combat the fear and stigma associated with the cancer diagnosis in Nigeria?
What we can do is like we bring about survivors like Gloria to tell their stories, that cancer, once diagnosed early, then the treatment, the cure is 100%. You can get cured from any type of cancer once it is picked early. The only issue is when it is advanced, then there's mostly palliative care that we can give patients. So creating more awareness about patients being screened and then picking up those lesions early and the treatment early with the government support, I think that would alleviate the fears that the society has about cancer.
Okay, just before we let you go, because this is also a very important issue, I'd like to hear from you. How can mental health support be integrated into cancer care in Nigeria, considering the emotional toll on patients?
Yes, that is a very important aspect of cancer treatment. Like I mentioned earlier, we have a chemotherapy center here in KB, and there's also a psychologist there. Because for someone to be having cancer, some take it as a death sentence. So for them even to agree to have the treatment and also with the side effects that it comes with, it's not only the treatment that patient needs, it's also he or she needs psychological support and which we have so many clinical psychologists who can be employed in various cancer centers in the nation, who can actually have sessions with patients before or after their treatment, because the treatment is in phases. So at each phase, patient needs to get counsel on what he expects for his fears to be expressed and solutions to be proffered. I think that will go a long way in for patients to actually come to the hospitals to access care.
Okay, thank you so much, Dr. Mohammed Jamilu. That's the much we can take from you. Thank you so much for your insights on the program.
Thank you so much.
In conclusion, cancer awareness in Nigeria requires a unified effort from the healthcare sector, government, and communities. By understanding the major signs and also committing to regular screenings and dispelling myths, Nigerians can take significant steps toward reducing cancer-related mortality, and also empowering individuals with knowledge and resources is the first step in making early detection and treatment more accessible and ultimately improving cancer outcomes across the country. And that's the much we can take from the program at this moment. Remember, you can always connect with us. Do well to join our YouTube live stream and also join us on the website and check out our YouTube for more episodes of the program, previous episodes and subsequent episodes. I am Aisha Salihu. Before we go, we'll be leaving you with some facts about cancer awareness.